Singapore has confirmed one new case of COVID-19, the lowest number since the first week of this month. The latest case is a 36-year-old male Chinese national.
Now, he's a work pass holder with no recent travel history to China, and he's currently at NCID, and contact tracing is underway.
3 more patients have been discharged, taking the number who've recovered to 37. They are cases 6, 16 and 66.
With the latest confirmed case, Singapore's total number of infection is 85.
Of the 48 patients who are still in hospital, most are stable or improving. 4 are still in critical condition. 1,147 people are quarantined, while 1,469 have completed their time in isolation.
A woman who was first admitted to hospital for dengue fever before she was found to have the coronavirus is now confirmed to be infected with both. All patients who were warded with her at Ng Teng Fong Hospital have been quarantined.
The Health Ministry provided some clarity on the case of the 57-year-old Singaporean, which was first revealed yesterday. Cheryl Go with more.
MOH confirmed that hers was indeed a case of co-infection, which means she has both dengue and COVID-19 at the same time. But they stressed that this is an extremely unique occurrence and the only known case in Singapore so far. They also clarified that dengue does not develop into COVID-19, and the patient was tested for the COVID-19 virus because she complained of respiratory symptoms such as cough, runny nose and fever. It's good to note that dengue symptoms are usually fever and perhaps a rash, but not respiratory. This means not all dengue patients need to be tested for COVID-19. The ministry reiterated that COVID-19 is still very new, so it is still too early to establish any links or patterns with other diseases.
The test for the COVID-19 virus is often carried out alongside other tests for patients who show up with a fever or headache. That's because these symptoms are also common to regular pneumonia, dengue or flu. Forrest Jeremy finds out what's involved in the process.
Nasal swabbing is carried out on patients suspected of COVID-19. The swabbing process takes some 2 minutes, as one swab gets inserted all the way into the back of the throat, just behind the nose, to collect a mucus sample from the individual. This trolley contains all the equipment required to do nasal swabbing. So here we have the swab, which will be used to collect the specimen, and after the specimen is collected, it will be placed inside this universal transport medium bottle. The universal transport medium bottle will be placed inside these Ziploc bags, which will be then dropped inside the cooler before being brought to the lab for testing. Now, the nurse conducting the swabbing is also required to wear personal protective equipment. Trained health professionals are needed to collect accurate samples due to limitations of the test, which is a very specific one that looks at the genetic material of the virus. Timing matters as well.
You have to actually look at the timing of when the sample is collected in relation to when the symptoms started. So this is a coronavirus, and we know that coronaviruses, the sample results can turn positive later in the course of illness. So sometimes, 6 days, 7 days after someone has started having fever and cough. So if the test is negative, but we have reasons to suspect that the person has the infection, then we will repeat that sample until it turns positive, or we have a clear alternative reason for the pneumonia.
Another doctor at this Public Health Preparedness Clinic, or PHPC, says it's possible to contract COVID-19 alongside other infections, such as dengue, which is why several tests are needed.
It worries me more when patients who come with high fever and with a longer duration of fever. For example, those that present with longer than 3 days, example 5 days, 7 days. So patients who come to me, I will have to do extensive workup for the fever at my level. For example, I will do an influenza A/B swab, and I will do some blood tests like a full blood count as well as dengue serology or a dengue test kit. So this helps me to at least rule out some causes of fever, okay, and if it has a high suspicion of COVID-19, I will do a referral for further testing in the hospitals for this.
Still, doctors say it will be rare to get both COVID-19 and dengue. One is a respiratory tract infection usually transmitted by droplets, while the other is passed on by mosquitoes.